And I'll just give you a little brief background about myself. I've been involved in, well, first of all, I'm also Israeli. I lived in Israel 8 years from 1978 to 86. And at least Hanan, I think you may know of a gentleman I used to work for. His name was Shaul Eisenberg from the Eisenberg
Yes,
Group.
yes.
And yeah, he had opened up, he was, of course, a very important businessman in Israel. And he'd opened up an office in Beijing, and I speak Chinese. So he hired me to work for him in Beijing and in Israel. But most of my
Mhm.
life, I've been working in the healthcare field. I worked for a company, the head of sales of a company called Atrix Worldwide. You may have heard of them because we have an office in Israel. Um,
Mhm.
and we got involved with Israel because there was an Israeli company that made a device that would measure your foot that became part of our company. And eventually we bought the company. And in fact, I just had a meeting with the head of the company in Israel an hour ago. He's here in New Jersey for a couple of days. So that worked
Mm.
out. But I've been working with biocompression now for over 10 years, responsible for their sales to the Middle East and Far East. And biocompression, based in New Jersey, not far from New York City, is a manufacturer of what we call gradient sequential compression devices that are used for a variety of therapies, including lymphedema, which we'll focus on today, cold therapy, cryotherapy, of course, uh, and also arterial therapy and DVT prevention, prevention of blood clots. So, and everything I want to emphasize is manufactured here in New Jersey. So it gives us certainly great control over delivering product very promptly. Because I've worked for companies whose manufacturing was in China or other locations, and that certainly was a challenge. And it's my pleasure to introduce our highly experienced, very professional, brilliant therapist, PJ Ross, who's a registered nurse as well as a registered um, compression therapist who would be most qualified to prevent a nice medical presentation on our products with emphasis again on lymphedema, since we understand that's the major interest at the moment. But we'll mention some of the other products as well briefly. So without further delay, happy to again turn it over to Ms. Ross.
All right. Thanks, Richard. Hi, everyone. Thanks for giving me your time. I know it's getting late there, early here. Sorry it was difficult to get on. I hope most of you are on. I am recording this, so I will send you the recording when we're finished. I am assuming you guys are interested in the lymphedema, like Richard said. So my presentation kind of covers all of the various things that we treat. A little history about biocompression. We've been around for over 40 years now, actually, and the company was started by my father. Um, and now it is a family company. My husband has taken over as president, and I am the clinical advisor. Um, and Richard is international sales. So I will just give it a start. That's me. This is just a picture to give you an idea. In our factory, this is part of our team. So everything is handmade in America, in New Jersey, and we take very much pride in our work. So to give you an overview of the lymph system and what lymphedema is, uh, we have about 500 to 600 lymph nodes throughout our body. Everybody is different. They are clustered in the armpits and the top of the groin, and that's called axillary or inguinal areas. There's also in the neck, we have a lot of lymph nodes in our neck. So whenever any of these lymph nodes are compromised, we can get lymphedema. So it's nice to just be able to visualize. This is a slide that shows the similarity that basically the lymph system runs in conjunction with the circulatory system, so that when we're pumping lymph fluid, we're also pumping blood, which is why we can also help with chronic venous insufficiency. Lymphedema. What is it? If you guys mute, I think it would be helpful if everybody muted. I can hear like a little bit of echoing.
Maybe you can mute everyone. You control the mute.
I can't actually on this app for some reason. Oh, I think everyone did. So lymphedema is a chronic progressive condition, and that is a very important thing to understand. So once a person has lymphedema past stage 1, and I'll talk about the stages in a minute, it is forever. So that's why home health care is so important for these people. And the earlier we catch it, the better. It does lead to persistent swelling, heaviness, and reduced mobility if left untreated. It increases your risk of skin changes, infection, and hospitalization. There is no cure, and it requires ongoing, consistent management. And again, early treatment leads to better outcome. With lymphedema, the lymphatic system is unable to adequately move lymph fluid. The fluid then accumulates in tissues and causes persistent swelling. It's most common in arms and legs, but it also can involve the truncal edema, which is kind of in the abdominal area. And we see a lot of head and neck lymphedema. Primary lymphedema occurs without a known cause, and secondary lymphedema is a result from either surgery, cancer treatment, infection, trauma, or disease. So the main point here is when lymph fluid can't move effectively, swelling progresses without ongoing management if you don't have the management. This is a picture of primary lymphedema. This specifically is Milroy's disease because it's present at birth. When it develops at puberty, it's called precox. When it develops after age 35, it's called tarda. And primary isn't that frequent. We see it about 2 to 3% of cases. Secondary lymphedema is much more common. And that, again, is caused by surgery. Oftentimes you'll hear cancer patients who have, when someone has cancer, a doctor has to take, their lymph nodes to test to see if there's cancer has spread. When they take those lymph nodes, oftentimes they create lymphedema. So without those lymph nodes, the lymph system is kind of compromised, and that creates lymphedema. So that's why we see lymphedema in so many cancer patients. Radiation therapy can also make lymphedema. Obstruction from a tumor, obesity, CVI, chronic venous insufficiency, all these things can create lymphedema. It is an under-recognized population. It's estimated 20 million Americans have lymphedema, but only 1.3 are actually diagnosed. There was a study done that med students weren't even learning what lymphedema was in medical school. But now that has changed. In the past 5 years, it is much more, kind of on the forefront, and people are recognizing it more. So that's an important thing to know. Each year, about 200,000 patients are referred to manual lymph drainage, but only half wind up going, because for these patients, they're usually they're usually older or they have trouble moving, so they can't get to their appointments. It's very hard. So that's why, again, home therapy is so important. There's gaps in access, awareness, and adherence, which leaves many patients just untreated. And these patients, again, are strong candidates for home therapy. So these are the stages I was talking about, the stages of lymphedema. 0 is latency stage. You can't see it visually, but the patient usually complains of like a heaviness in their limb. They just feel like they're swelling, but you can't actually see it. And stage 1, you can see a little bit of swelling. At this point, it is actually reversible. So if a patient is very aware, self-aware, they can go to their doctor and really, if they start pumping at this stage, they can reverse it and the lymphedema will get better. Stage 2 becomes true chronic, and that means there is no going back. They will have lymphedema forever. It's always swollen. There's evidence of fibrosis. I'll also tell you what that is. And one of the big things is when they elevate their limb, it will not reduce. So the size does not reduce with elevation. Stage 3, you start to see skin changes and severe edema. And then stage 4 becomes elephantiasis, where you get the lobules and just a very large limb. Fibrosis. So fibrotic tissue is tissue where the area of the limb becomes firm and hard, less elastic than normal. That is a buildup of the fluids have now made for like scar tissue formation. And that becomes difficult to pass, but pumping actually breaks that fibrotic tissue down and softens it. So that helps the fluid move past the fibrotic area. These are some pictures of what happens if lymphedema goes untreated. This is a picture of cellulitis. That is an active infection. If a patient has an active infection, they need to stop pumping because you can pump that infection throughout your body. So they need to be on antibiotics for 72 hours, 3 days, before they can pump again. That is a dangerous condition. And they do tend to get infections because lymph fluid is very high in protein. So any bacteria that gets in there creates an infection. And patients need to be taught really good skin care for that reason. That's a picture of leg ulcers. We can actually heal wounds faster by pumping because we are pumping like I said, blood along with the lymph fluid. So when we're pumping blood, we're actually increasing the oxygen in the area, which helps with wound healing. This is a picture of papillomatosis, which is like a scaly topical skin problem, and it comes from the oozing of the lymph fluid. This can be scraped off by the doctor, but hopefully we can prevent that with pumping. This is a picture of a patient who has not been treated, and these are lobules. So important to note here, biocompression can make this patient a custom garment. So you guys would send us the measurements of all these different areas, and we can make this patient a pair of custom pants. And we're the only company in the industry that does custom garments. Lipedema, I'm just going to mention it here quickly because it is becoming quite prevalent. So it's almost 99% time with women. And the difference here, you can see it's bilateral. And it is not lymphedema. This is not lymph fluid. This is fat. So this is fatty deposits that just happen. Nobody knows what causes lipedema. But the main thing to note here is that lipedema creates lymphedema because the fat is pushing on the lymph system. And so this person is a candidate will probably wind up getting lymphedema if they don't pump, which just exacerbates and makes everything worse. Another way you can tell this is lipedema and not lymphedema is the cuff here at the ankle. The feet are totally fine in lipedema. With lymphedema, this patient's feet would also be very swollen. So another disorder which can lead to lymphedema, but that we also treat, is CVI, which is chronic venous insufficiency. And that occurs when the valves in our legs, so when we're standing, our blood has to pump against gravity. So it pumps from our feet back to the heart against gravity. And in a healthy vein, we have these valves, and this is a healthy valve. And in a diseased vein, you have a broken valve, and that the broken valve doesn't move the blood anymore. So the blood is stagnant and it pools down by the ankles and the front of the calves. These are some signs and symptoms of CVI. You get this darkened color on the front of the calf. You get varicose veins. You get swelling. You get leg cramps and spasming, itchy skin, restless leg syndrome, and pain and heaviness in the limb. So by pumping, we move the blood back into circulation and we prevent the CVI from creating more problems. Donald Trump was just diagnosed with it. I wrote him a letter, but I never heard back. So the gold standard for treatment of lymphedema is CDT, complete decongestive therapy. And that is a holistic way of managing lymphedema. So CDT includes all of these things listed: manual lymph drainage, which I'm not sure if you guys know, but we have therapists, I'm sure you do in Israel, therapists who are trained to massage a patient with lymphedema and manually they drain the lymph fluid. But, you know, we all know it's not easy for these patients to get to them. It's expensive. It's temporary. So as much it works, there's no question it works, but we need to do all these things in conjunction. Compression bandaging is also needed in conjunction with all of this. And pneumatic compression is a big piece of this puzzle. Exercise, skin care, counseling for the patients, and self-care. All these patients need to understand. So again, pneumatic compression is an important part of this self-care. All these things are used in conjunction. We like to say that, so I don't know if you guys have ever been in the field and seen these lymphedema patients. A lot of them are old. A lot of them have these very heavy, big limbs. Getting these stockings on is very difficult. They're very tight. So we say we pump to reduce and then the stocking to maintain. So if they pump with one of our pumps, their limb, decreases in size enough for them to get their stockings on, much easier than if they just put their stockings on without pumping. And this is a picture of compression short stretch bandaging, which is done after manual lymph drainage. So the indications for use of our pumps are lymphedema, lipedema, phlebolymphedema, which is a combination of CVI and lymphedema, CVI alone, chronic venous insufficiency, restless leg syndrome, post-traumatic edema, post-surgical edema, and DVT prevention. This is for America for that insurance purposes. Benefits of compression therapy are a reduction of edema or swelling. We increase mobility and range of motion for these patients, which is of course the most important. Decrease risk of cellulitis or infection. We decrease in discomfort or pain, which is great because there's less meds involved. Increase in self-esteem, increase of circulation, which leads to faster wound healing, and an overall better quality of life. This is one of our favorite before and after pictures. This picture actually is 45 days apart. Contraindications for pumping. If ever a patient has an unresolved DVT, if there's a question of a DVT, they have to be cleared by their doctor to make sure there's no DVT before pumping. Any active untreated infection, like I mentioned before, they have to be on antibiotics for 3 days, and then they can pump. Unresolved congestive heart failure. And if a patient is medicated for congestive heart failure, that's totally fine. They can pump, but they need to be medicated. And then any other indication identified by the physician. By the way, I just want to make sure you guys know, if you have any questions while I'm talking, please feel free to ask. You can unmute yourself and we can be totally interactive here. I'm happy to answer questions. Target call points. We use these for our salespeople here. I'm sure it's the same for you in Israel. Your vascular surgeons, your podiatrists, orthopedic surgeons, oncologists, of course, any kind of cancer. Cardiologists do a procedure called a cabbage procedure, and oftentimes that can lead to truncal edema. Home health care agencies see a lot of these patients who are immobile. General practitioners, wound care clinics, vein clinics, and of course, lymphedema clinics. So on our website, biocompression.com, we have, it's a pretty comprehensive website. The science is a tab, and under that is all of the studies that we have that prove the efficacy of our machines. So a couple of them highlighted here. Studies by Dr. Alvarez and Dr. Lulov for wound healing. Another study for wound healing with venous ulcers. Another study for post-mastectomy patients. But there's many, many studies on there. This is just a nice quick study to show. This was a 12-week study, and you can see clearly the reduction in pain, reduction in inflammation, and reduction in these ulcers, just in a very kind of easy to read study. So this is our, these are our pumps, our lymphedema pumps. This is our 2000 series, and this is our 4000 series. We are coming out in the next few months, actually, with a 4100 series, which is going to be, you can see our 4000 series has a digital screen, digital touch screen. The 4100 is going to look more like this. It's going to have buttons, but the screen is much bigger. We're excited about that. So our 2000 series features include, there's a timer, there's a pause button, focus therapy, adjustable pressure, adjustable cycle time, compliance meter, so the patient knows how many hours they've used the pump, and a digital screen readout. The 4000 series, as you can see, has the touch screen. There is same features, except for the 4000 series has pre-treatment mode. And also in the 4000 series, we have the ability to adjust the pressure in separate chambers. So pre-treatment mode is also called decongesting. And this mode helps you prepare the lymph nodes for treatment. So it's basically like if you were going to an MLD, a manual lymph drainage therapist, they would massage the area of the lymph nodes first before treatment to open, they call it opening the watershed, but it basically prepares the lymph nodes to receive the lymph fluid that's going to be coming towards them during treatment. It's a picture of our pump in use. So this is a great slide of how our pumps actually work. So our pumps mimic manual lymph drainage by compressing in a distal to proximal way, distal being the furthest from the body, proximal is the closest towards the heart. Our pumps are non-peristaltic, which means they start at the furthest away chamber, distal, inflates and holds until number 2 inflates and holds, then 3, 4, 5, all inflates and holds. And then when it reaches 8, it all deflates. And then the cycle starts again. So with other companies that I'm sure you're aware of, some of their products are peristaltic, which means the first chamber will inflate, and when the second chamber inflates, the first one deflates. And studies have proven that that causes backflow. We like to compare it to squeezing a tube of toothpaste. So we are squeezing the toothpaste from the bottom, and they are squeezing it from in the middle. Some terms that are important to note with pneumatic compression. So a lymphedema pump is an intermittent pneumatic compression device with sequential gradient pressure. Intermittent meaning non-continuous pressure or rhythmic steady contractions. Pneumatic just means that the compression is from air. Sequential means that the chambers inflate in an order. And gradient pressure means that the pressure decreases from chamber to chamber. So in addition to our pump holding in each chamber and then inflating the next chamber, we also decrease. So if our pump is set to 60 millimeters of mercury, the next chamber is automatically 58. So the foot, let's call it a leg sleeve, the foot would be 60, then 58, and then 56, and on upwards, reducing in pressure a little bit as we go up. That also helps for movement of fluid. All of our pumps are non-peristaltic gradient sequential devices. So the difference between the 2000 series and the 4000 series, like I was showing, is that the 2000 series is not able to be calibrated. So you can't change the pressure in each of the chambers. You don't have that ability. In the 4000 series, we have the ability to change the pressure in a certain chamber. So if a patient has surgery or a spot that shouldn't be pumped for some reason, you can reduce the pressure in that one specific chamber. We do have the most extensive array of garments in the industry. We have over 50 different standard sizes available off the shelf, shipping the same day. And like I mentioned, we are the only company to make custom sizing. So any unique size patient you will have, we can make them a sleeve. So we would just need your measurements. The measurement sheet is actually on our website as well. So you can access it through the website, print it, and then fill it out with all your measurements. This is a picture of some of the off-the-shelf garments we have. We also, in the next month or so, are coming out with a head and neck garment, which we've been, it's been in the works for a while. We are very proud of it. We're seeing a lot of head and neck. A lot of our DMEs were requesting it, a lot of head and neck lymphedema. So that's coming soon. Our garments have a special baffle system, so it creates a smooth transition of air from chamber to chamber, seamless delivery of pressure. That's very important. This is a picture of some of our sewers at work in our factory in New Jersey. Additional products we make, in addition to lymphedema products, we do DVT prophylaxis, arterial pumps, which I will talk about. It's a very new, amazing category, and cold compression therapy. Our multi-flow DVT, this is for hospital use or home use, but it basically prevents DVTs. I'm sure you know, anyone who goes for any surgery, the first thing you do, you get on the table, they strap these on to prevent any clots. This particular pump has a third port that you could attach a cold compression to. So if someone's having orthopedic surgery on a knee, on an ankle, on a elbow, shoulder, wrist, we make a sleeve for those parts in a cold compression, and that helps with recovery. This is our portable Vascuease, portable DVT, battery operated, no tubes, battery runs for 20 hours, great for transporting from hospital to home. The sleeves are disposable. The battery pack is reusable. So you buy this from us and you reuse, the sleeves get thrown away by the patient and you can reuse this with another patient. This is just a picture of what a DVT actually is. It's a deep vein thrombosis, which is a clot in the leg, and we want to prevent that. So our bioarterial, really, really amazing product. We are saving limbs. I promise that is happening for diabetics, for peripheral arterial disease. It's different than our lymphedema, as you can see the picture. It's a kind of more like a cuff-like, and it cuffs around the foot and the calf, and it's very high pressure. So it's 120 millimeters of mercury, and it mimics walking, basically. So we are really preventing amputations with this. It mimics the calf, the pumping action of the calf when you're walking. And we have a lot of studies on it that we're creating collateral arteries for any arteries that are blocked. The body's actually creating arteries itself with the high pressure. This is a picture of our new arterial, which is also coming out in the next few months. It's a little bit more high tech than, I'll show you the picture of this one, kind of, you could see it's a little bit an older model. So our new model is more high tech, and it's been doing very well. These are some studies on the bioarterial, really kind of in-depth science behind how it's working, also on our website. So why biocompression? We are designed for better outcomes and better compliance. Compliance is the most important thing with these patients, because if they don't use it, it ain't gonna work. So we got true sequential compression, not peristaltic, and helps reduce risk of backflow. We have a wide selection of garments, fits most patients. Easy to don and doff garments, easy to put on and off, that support daily use. Our garments are easy to clean with antibacterial wipes. We're user-friendly, designed to promote patient compliance, and we are proudly made in the US. Biocompression makes it easier for patients to use therapy consistently, and we have found consistency drives results. Why pumping helps in lymphedema management? The benefits of pneumatic compression are we're reducing swelling, we help relieve pain and heaviness, support wound healing, lower the infection risk, improve circulation and oxygen delivery, and overall enhance quality of life. If lymphedema is left untreated, we will see progressive worsening of the swelling, a skin breakdown and infection, increase of hospitalizations, and permanent tissue changes and disfigurement. Again, the key takeaway is lymphedema is chronic and progressive, and consistent home therapy slows that progression and improves outcomes. And that's it. This is me. This is contact, my email. And any questions?